Everyone, my name is Teresa Carr. I am a BCBA here at Professional Therapy Associates. Today, I have a group of student analysts who will be presenting on ADLs at home.
Hi, my name is Courtney Hendricks. I'm one of the student analysts at Professional Therapy Associates, and today I will be talking about supporting ADLs at home. So an overview of what we'll be talking about. This is activities of daily living, routines and schedules, visual supports, examples at home, transitions, tips for success, task analysis, socially mediated contingencies, prompting, and fading. So activities of daily living are tasks required for independent living. These can be referred to as the basic self-care tasks that we do every single day, such as eating, getting dressed, bathing, using the bathroom, and much more. In the field of ABA, we teach and incorporate these skills step by step, especially in those with developmental disabilities like autism spectrum disorder. Through teaching ADLs, our goal is to make our clients more independent throughout their days, improve their confidence, allow them to properly take care of themselves, and overall make them as successful as we possibly can. So some ways that we can do this are by creating routines and schedules. This is very common in the field of ABA, especially when we want to implement this at home. Using routines and schedules help in creating structure, reducing anxiety, and making behaviors more predictable and manageable. A strong tool to use in this area are visual schedules. These are like to-do lists with pictures or icons. Visual schedules help with transitions, support independence, build structure, decrease challenging behaviors, and much more. So you could see on the left, we have morning routines and evening routines, and the child can just check off when they do each task.
Hi, I'm Mara. I'm a student analyst here at PTA, and now we're going to get into a task analysis. So a task analysis breaks down a task into smaller steps, which makes it easier for children to learn and complete tasks at a rate that is suitable for different learning styles. Using reinforcement and prompting procedures after each step of the task, uses step-by-step teaching strategies, can identify where support is needed throughout the task, and promotes independence, and it's also easily customizable. So these are some examples of a task analysis. So we have personal hygiene, so it kind of breaks down each step of washing your face, brushing your teeth, putting deodorant on, and then same with how to make popcorn. It kind of just gives you a little rundown of each step, and it makes it easier for the child to understand. Socially mediated contingencies. They occur when a consequence from a specific behavior is delivered by another individual. Examples can include praise, help, attention, or access to a preferred item. Using these while teaching ADL skills are crucial to developing motivation towards completing a specific task. Individuals learning to perform ADL, such as brushing teeth or dressing themselves, the outcome mainly depends on the feedback. So here are some examples at home. For brushing teeth, the behavior, a child brushes teeth for 3 minutes independently. A consequence would be the parent provides the child with praise and grants access to a preferred video, such as a movie or a TV show. And next, getting dressed, the behavior is the child successfully puts socks and shoes on independently. And the consequence, the parent provides the child with praise by saying, "Great job," and gives the child a high five. So some helpful tips. Reinforce immediately. This will help the behavior of completing the task continue throughout the future. Figure out what is reinforcing to the learner, what they value, what they like to do, what motivates them, etc. As time progresses, change the wording from "great job, you earned a reward" to "you did that all by yourself." This will maintain the behavior by making it more naturally occurring to the child. Pair social reinforcement to natural reinforcers. This can look like, "You did a great job brushing your teeth. Now they are nice and clean so you can smile all day."
Hi, I'm Anna Tillman. I'm a student analyst with PTA, and I'm going to be talking about transitioning out of the house. So this slide is to help parents understand that transitions aren't just misbehavior, they're often due to skill gaps or being overwhelmed. So why transitions can be challenging. Children may have trouble stopping engagement in a preferred activity. Child may feel rushed. Child may not understand what's coming next. A child may have difficulty processing changes in routine. So ABA gives us tools to break this down and support success. So we help to create predictable routines, teach steps on getting ready, using task analysis and prompting, and this all ultimately helps children become more independent and reduce stress. So these are some visual tools that you can use for transitioning out of the house. It's first then boards and a countdown timer. So the first then is you start with a task that they need to complete before they leave the house. And then you say then they're given a preferred item, preferred activity. So for example, leaving the house, you could say first you put shoes on, then you get iPad time in the car. Countdown timers, my example is you have 5 minutes left, then it's time to go. This just helps them feel less rushed because they have a visual of how much time they have left. So you could also use behavior momentum. So what is this? It's pretty much starting with an easy task first to build compliance. So you're going to start with a high probability task. So what's something that your child is more likely to do? And then you're going to move to a low probability task. So something that they don't do. So my example was give me a high five. If this is something that they like to do, you have a high probability of them doing it. You reinforce them, and then you move to the low probability task of putting on your shoes to leave the house. So it's important to always reinforce these behaviors. So you could get verbal praise, you could say good job, you could do tokens if you're doing tokens like a token system with your child, and as Mara stated, reinforce immediately. So these are just tips for success. Practice your transitions out of the house during low pressured times. Don't do it when you have to leave, you have to be somewhere in 5 minutes. Do it when you know you have a lot of time to just relax and do things at a slower pace. And then give limited choices. So my example is you could say, do you want to put your shoes on first or your coat? Always stay calm and consistent, and then remember to fade prompts gradually.
Hi, I'm Jade. I'm a student analyst at PTA, and I'll be discussing prompting and fading. So when we say prompts, we're referring to hints or cues we give our client to help them perform a response that we would like them to learn. Our goal is to practice the target activity with prompts until the child can confidently perform it by themselves. As they become more independent, we can start fading the prompt out. There are several types of prompts used in ABA. The most involved type of prompt is physical prompts. This would be hand-over-hand assistance or guiding the child's arms by the elbow to help them perform a task. Examples of this are hand washing, so holding their hands under the water, pushing the soap dispenser, and doing the hand washing motion for them. Another one could be making food, maybe helping the child use both of their hands to hold a bowl and the other hand to stir, or even to pour a box of cereal. So basically any task that involves fine motor skills or motor planning that a child may need help with, they would benefit from physical prompts. Next is model prompts, which is acting out or demonstrating the desired response. For example, showing your child how to make the bed at each step. There's also verbal prompts, which are spoken instructions or directions, like put your clothes in a basket. Then there's visual prompts, like pictures, videos, or one of the visual supports mentioned before that can be used to demonstrate what the target response is. And lastly are gestural prompts, which is just pointing, nodding, or making an action that would produce the target response. This is a visual of a prompt hierarchy where more intrusive or involved prompts are at the bottom and less intrusive prompts are towards the top. The higher up on the hierarchy the prompt is, the more independent the child is on performing the task. Again, our goal is for the child to learn an activity with help until the cues or hints aren't needed anymore because they're able to do it independently. So we might start by using a physical prompt and eventually only need a verbal prompt, which would indicate progress in that the child is learning how to do it by themselves. And there are also many different methods of fading out prompts gradually to help promote independence. So the first is most to least prompting, starting with a more intrusive prompt down on the hierarchy, and then slowly introducing less intrusive prompts. There's also least to most, starting with a less intrusive prompt and then seeing what the child needs to better learn the activity. So maybe you start with a verbal prompt, and if they're not able to perform the target response, move down the hierarchy to a model prompt. There's stimulus baiting, which is reducing the intensity or salience. For example, giving less visual supports over time or saying less words when giving verbal prompts. There's time delay, which fades prompts by increasing the time between giving a direction and providing a prompt. And lastly, there's proximity to learner, which involves increasing the physical distance between you and the child while providing the prompt so it feels like there's less monitoring and more independence being built.
Hi, I'm RJ Miles. I'm a student analyst at PTA, and I'm going to be going over chaining procedures. So behavior change is each piece of a behavior is seen as separated, and then we complete through multi-step chaining procedures. We have 3 different types of chaining ways, which is forward chaining, backward chaining, and total task presentations. So the first one is forward chainings, and when we go into breaking down a behavior, we focus on going from the first step and completing that and using all of the other steps that are taught in order in a prompting value. So we usually want to stick with a full prompt to start everything and making sure we try to take that first step down. So as forward chaining starts from the first step, backwards chaining, we start from the last step. So we take our prompting factors back into the equation, and we use the last step as the one that we want to start praising more and bringing down into the independence factor, and then we bring it backwards. Now a total task presentation, all the steps of the change are taught simultaneously, and it's similar traditions to teaching all of the prompting at the same time. So you want to continuously break down each step from full prompting down into independence all at the same time.
Hi, I'm Angela with PTA, and I'm going to talk about collaboration with the professional care team. So all of the visuals that you've seen with the token board, the first then boards, and all of the visual schedules can be made if you talk to your BCPA. They can each be specified for the individual client, since ADLs do look different for each client and their family. So we want to make this as realistic to the home life as possible. So for example, if you want to target using silverware at the dinner table, your BCBA can talk to the occupational therapist and the feeding therapist about what might work best and how everybody can work together to help promote this skill for the client. And don't be afraid to ask questions or ask for assistance. Examples of ADLs at home include using the toilet, managing bladder control, washing hands, brushing teeth and hair, showering and bathing, getting dressed, making food, eating, doing housework, and managing money as they get older. These are all done by everybody every day, and we just want to work on promoting independence, compliance, and motivation for our clients working towards these skills every day. And although we're focusing on the home environment, these do also work outside of therapy and home in the community. So for example, if you talk to your BCBA and something that's really important to you and your family is working on going out to eat as a family, some of these ADLs can work over towards you guys meeting that goal. So for example, hand washing and toileting. If you are already on a schedule with your client for potty training and it is working consistently and you want to go out to dinner, you should be able to go out to dinner and continue that routine with your child. And the BCBA can help you make a visual schedule or a token board for after they complete the skill. Or for example, eating at mealtime, they may be able to sit with the help of headphones, videos, or other activities. And this can be worked on with OT and ABA therapists during ABA therapy to remain seated in a group setting during mealtime. And ultimately, we want to promote independence. Although we work from different areas first, we ultimately want our clients to have as much independence as possible. So giving them choices, as Anna said, would you like to carry your plate to the sink or your cup to the sink? We want them to be able to carry both of them to the sink. However, we also want to give them that independence of making a decision. Or brushing their teeth, you might want to give them an example of, do you want to step on the stool first or do you want to turn the water on first? And in conclusion, teaching these skills to the children with autism are essential for promoting independence, self-confidence, and their overall quality of life. Mastering these skills, such as personal hygiene, preparing meals, managing money, and are all tools needed to navigate daily life. We don't want the clients to only rely on the caregivers. We want them to be able to participate in these skills at home, school, and in community settings. And we want them to be as specific and realistic to the client's life as possible. And the parents and family do play a pivotal role with supporting the child, providing resources, and giving them that confidence after they meet the skills and are working towards them. Thank you.
All right. Thank you so much to our student analysts for putting a lot of work into this presentation. It was a great presentation with many great examples. Activities of daily living are important, as you've heard. You teach them in all settings, right? So we teach them within the clinic, we teach them within home, we teach them within the community. And like it was said, it was to promote that independence. If you do have any questions, comments, or concerns, or want visual schedules, or need different ways of how to present this, please reach out to your child's BCBA and they will be more than willing to help you. So thank you guys for listening and have a great night.